This is Bob Flaws, and on this YouTube segment, I'd like to talk a little bit about the word classic in terms of Chinese medicine, what it means, and also what it doesn't mean. For the last couple of years, I've seen more and more Westerners talking about that they're doing classical Chinese medicine as opposed to traditional Chinese medicine or contemporary Chinese medicine. And I've heard more and more Westerners saying, "Oh, we need to study the classics, and the classics are where it's at. That one has to be thoroughly grounded and educated in the classics." And and oftentimes, in my experience, when people are using this word, the classics or classical, they're not really using it in the way that this term is used in China. So I'd like to just go over what Chinese generally, how Chinese generally use this term. In fact, in China, the word classic is fairly restrictive. There aren't that many classics of Chinese medicine. Mostly this refers to books before the end of the Han Dynasty. We have four great classics of Chinese medicine. We have the Neijing, which of course is divided into the Su Wen and the Ling Shu. Then we have the Nanjing, and then we have the Shahan Lun and the Jinkui Yaolue. These four are indisputably considered classics by everyone in China. Once you get past these four, then fewer and fewer Chinese doctors are going to be willing to call something a true classic. Generally, the Han Dynasty was seen as the classical period of Chinese history and culture, and it is books that either came from before the Han Dynasty but were seen as very important in the Han Dynasty, or books that came from the Han Dynasty that are generally talked about as classics. So when Westerners start talking about studying the Shahan Lun, for instance, which has become very popular recently, then certainly there we can be talking about classical Chinese medicine. Or if we're talking about basing our practice on the Neijing, certainly there we can be talking about classical Chinese medicine. However, some Westerners simply talk about classical Chinese medicine as anything before New China. New China meaning the communist regime coming to power in 1949. Or if 1949 is too modern for some people, maybe the cutoff date is the turn of the 19th into the 20th century. However, I would not refer to literature from, let's say, the end of the Han Dynasty up to even the beginning of the 20th century as the classics of Chinese medicine or classical Chinese medicine. I think the more proper term is pre-modern Chinese medicine. I think most people think of the modern era beginning in the 20th century. If we really are going to say that we practice classical Chinese medicine, and by that we're going to restrict ourselves to the Neijing, Nanjing, Shahanlun, Jinkui, Yaolue, then we're talking about a very, very restricted understanding and practice of medicine. There was so much great Chinese medicine developed after the end of the Han Dynasty. It means that we would not have the Shenlong Bansao. It means that we would not have the work of Sun Tzu Miao. It means we would not have the work of the four great masters of the Jinyuan dynasty. It would mean that we would not have the great authors of the Ming dynasty like Zheng Jingyue and Li Shizhen. It would mean that we would not have access to all the teachings of the great Qing dynasty, great Chinese doctors and authors of Chinese medicine, such as Ye Qianse, Wu Youke, Gongding Shen. I could go on and on and on, listing some of the great Qing dynasty doctors. So I think that we Westerners need to be a little careful when using this term classical Chinese medicine and saying that classical Chinese medicine is the really good Chinese medicine. Especially if what we really mean is everything up to, let's say, 1949, or everything up to the beginning of the 20th century. There, I think mostly we should be talking about pre-modern Chinese medicine. I recognize this is not as sexy and that it's not going to sell as well, that it does not have the cachet of the word classic. But in fact, I think people that are saying we should be practicing classical Chinese medicine are actually selling us a bill of goods based on this sexy word classic and classical, which they're simply misapplying.